Welcome to Lower Columbia College's Bloodborne Pathogens Prevention Program training. You have been selected to complete this training because you may be exposed to a bloodborne pathogen during the course of your job duties. During this training, you will learn about the risks associated with exposure to bloodborne pathogens, how to prevent exposure, and what to do if you believe you have been exposed. This training will walk you through each major component of LCC's Bloodborne Pathogen Prevention Plan. A complete copy of this current plan is available on this Canvas course located under Files. The plan may also be found on LCC's Safety and Security webpage. So what is a bloodborne pathogen? A bloodborne pathogen is any pathogenic microorganism present in human blood or other potentially infectious material that can cause disease in humans. These pathogens include, but are not limited to, hepatitis B virus and human immunodeficiency virus, or HIV. LCC has identified the following job classifications as being at risk for occupational exposure to a bloodborne pathogen based on their assigned tasks. Custodial and maintenance staff, which may encounter a bloodborne pathogen during cleaning or first aid activities. Nursing faculty and staff, which may have exposure while in the clinical setting. Safety and security, which may have exposure while performing first aid, encountering altercations, and during the transportation and disposal of biowaste. Biology faculty who work with human specimens containing blood or bloody tissue. Childcare faculty and staff may also be exposed to a bloodborne pathogen. Because their needs are unique, they have developed their own bloodborne pathogen plan separate from LCC's main document. According to state law, these identified groups must complete a bloodborne pathogen prevention training once each year. For each task that puts the employee at risk of exposure to human blood or blood products, universal precautions will be used. This means that all human blood and bodily fluid should be treated as if it contains infectious pathogens. Be sure to always use engineering controls first to prevent exposure to a bloodborne pathogen. An engineering control is a type of technology that limits an employee's exposure. Examples include local exhaust ventilation and analytical instruments. Now let's talk about sharps containers. Sharps containers are used for items such as needles and lances. LCC requires sharps containers to be immediately accessible to personnel, closable, puncture-resistant, leak-proof on the sides and bottom, and properly labeled or color-coded with bright red or orange. Sharps containers should also be designed so that it's easy and safe to determine if the container is full. Sharps containers should always be placed on a level, horizontal surface, maintained upright and closed when moved or replaced. Single-use sharps disposable tubes should be used by custodial and security staff to collect and contain improperly discarded needles. These tubes are designed to hold both syringe and needle, making needle separation from the syringe unnecessary. Once the used syringe and/or needle have been placed in the tube, it is not to be reopened. The entire tube with the syringe and/or needle is to be discarded in a sharps container as soon as feasible. These sharps containers are located in first-floor public restrooms of most campus buildings. Never handle a needle with your hands. Always wear gloves and use a pair of forceps to avoid direct contact with blood or other potentially infectious material. If you need single-use disposable tubes, please contact campus security. Washington Administrative Code specifies the requirements for specimen containers. Specimen containers should prevent leakage, be color-coded and labeled, and be placed inside secondary containment when contaminated or if the specimen could puncture the original container. Work practice controls are those that are universal and mandatory for everyone working at Lower Columbia College. Please review the Work Practice Controls section of LCC's Bloodborne Pathogen Prevention Plan. Appropriate personal protective equipment, or PPE, will be provided by LCC to employees at no cost to the employee. This would include, but not be limited to, gloves, masks, eye protection, face shields, gowns, aprons, and other protective body clothing. Before assigning necessary PPE, a supervisor must complete a hazard assessment for their employee. Employees working with human blood and bodily fluids must use PPE in conjunction with barrier protection, work practices, and engineering controls. It is important to keep PPE clean and in good repair. Be sure to replace defective PPE. Remove PPE prior to leaving your work area, and always wash your hands after removing PPE. It is important to note that natural latex rubber may cause serious allergic sensitivities to develop. Contact your supervisor to discuss glove and other barrier protection alternatives. Employees who are allergic to glove materials that are normally provided should have access to at least one of the following alternatives: non-latex gloves, glove liners, powderless gloves, or similar alternatives. Utility gloves should be worn when the risk of accidental puncture wound is anticipated. Disposable single-use latex, nitrile, and/or vinyl gloves can be used when performing housekeeping duties or first aid where there is no accidental puncture wound or chemical handling anticipated. Some situations may call for double gloving for best protection. Please stay tuned to the following video to view the appropriate donning and doffing technique for disposable gloves.